Thanks very much, and again, welcome and good morning to this congressional briefing brought to you by the Patient-Centered Primary Care Collaborative. Today, we continue our important work to inform policymakers and payers, employers, and the public about the value of primary care and the notion of the patient-centered medical home leading to a better healthcare system. I am Dr. Doug Henley, Executive Vice President and CEO of the American Academy of Family Physicians, and I'm here today as Chair of the Board of Directors of the Collaborative. Let me first acknowledge the important organizations that have partnered with us and have provided the necessary support and resources for both the event that we have today as well as the evidence document that we'll be releasing at this time. First, I'd like to recognize Chris Kohler, who's president of the Millbank Memorial Fund, for the sponsorship of our publication. Thank you, Chris. And Justine Handelman from the National Blue Cross Blue Shield Association, and they are sponsoring this briefing today. Let me next acknowledge our CEO, Dr. Marcy Nielsen, and her great staff of the Collaborative who made this all possible. And Marcy, importantly, along with her staff and Drs. Paul Grundy and Kevin Grumbach, were the authors of the evidence report, primary authors of the evidence report that we release today. And importantly, a special thanks to Senator Grassley and his staff for hosting this event today. And I would like to introduce Rodney Whitlock, who's the Director of the Health Policy Director for Senator Grassley, for a few remarks. Rodney, please.
Thank you for feeding my enormous ego with applause. I do appreciate that. Thank you all for being here today. The Senator would have been here, but as many of you well know, the absolute most dangerous place in Washington is between Chuck Grassley and the airport after the last vote. So after last night, he was out of here in a flash. And I also hope you'll forgive me my my Friday the Boss Ain't Here uniform today. So my neck feels so much better. Anyway, thank you all for being here. It's very positive to have you all here. And what I really would like to thank is CMS for having their little announcement. I'd love to suggest that my powers of persuasion are such that that I helped arrange that in any way with timing with this to make this even far more relevant than it actually would have been otherwise. But CMS clearly has put concepts like we'll be talking about this morning on the table with their announcement on Monday. And that much as we fret over the concept of Medicare as we know it, in this town, one of the easiest ways to start a fight is, well, hey, wait, you're changing Medicare as we know it. Why are you hating on Medicare as we know it? The fact is, Medicare as we know it is radically changing right in front of our eyes. The concept of the siloed, per-service, quantitative basis approach to healthcare is going away. And it's being replaced by the collaboration, the concept of all of the many P's and C's here, the PCPCC, R2D2. Anyway, 3PO that we have here. But these are critical, and better understanding them and how they can actually be actionable in the future as we move to a different way of looking at the provision of healthcare, especially through Medicare, is important. So thank you all for being here, and thank you all for letting us be involved. It's our pleasure.
Thanks, Rodney. I've just started calling it the Collaborative, and that's a whole lot more simple. In fact, founded in 2006, initially by the Academy, along with the American Academy of Pediatrics, the American College of Physicians, and the American Osteopathic Association, along with IBM, the Collaborative is dedicated to advancing an effective and efficient healthcare system built on a strong foundation of primary care and the medical home. We achieve our mission through the work of our 5 stakeholder centers, which are led by thought leaders and experts who are dedicated to transforming healthcare in the U.S. through delivery reform, payment reform, patient engagement, most importantly, and employee benefit design. Today, the Collaborative membership represents more than 1,200 organizations who are medical home stakeholders and supporters throughout the entire country. Now, the briefing today is focused on releasing our annual report that presents the evidence base regarding the value of primary care and the medical home, and the innovations that are going on around the country in delivering primary care in a different and better way. I've always said before that healthcare reform in this country will not be successful in its transition from its current healthcare enterprise to a true healthcare system without investing appropriately in primary care as its foundation. Now, most of the briefing today will be dedicated to a panel discussion that Marcy will lead among several experts that I'll introduce in a second. But I first just need to make this comment on an exciting day like this. My favorite quote is from Winston Churchill when he said that you can always count on the Americans to do the right thing after they first tried everything else. Sound familiar? Well, for decades in this country regarding health care, we have been trying everything else first. And finally, I think today we're getting it right to realize that essential improved health care requires foundational primary care in order to deliver on the triple aim of better care, better health, and lower cost. So now let me introduce our panel. First, Marcy Nielsen, our CEO, whom I previously recognized. Chris Kohler, President of the Milbank Memorial Fund. Raul Rajmakar, who's the Acting Deputy Director of the Center for Medicaid and Medicare Innovation. Raul, thanks for being here. Justine Handelman from the National Blue Cross Blue Shield Association, where she serves as Vice President for Legislative and Regulatory Policy. Julie Shields, who's the Director of Care Delivery Transformation at Anthem. And Catherine Tony Clark, a practicing family physician in the Integrated Medical Group of the Kettering Physician Network in Beaver Creek, Ohio. And I want to finally emphasize that after Marcy does her introductions and leads the panel, we certainly want to engage all of you during the Q&A at the end of this briefing.